Mrs. Faith Johnson is a 65-year-old mother, wife, and grandmother who was diagnosed with severe acquired apraxia of speech after suffering an ischemic stroke 9 months ago. The damage to her perisylvian area has had significant effects on her ability to speak. Mrs. Johnson's first symptoms were groping of the tongue and lips when attempting to posture articulators correctly in order to produce the next set of speech sounds. According to her family, Mrs. Johnson is better at producing automatic speech, uses a slow speech rate, and has inconsistent errors where she omits certain parts of the word and will say the same word correctly in the next sentence. Mrs. Johnson notices that her husband and family and friends often don't understand her right away and at times need her to repeat what she says. Mrs. Johnson explains her frustration because she knows what she wants to say, but that's not what comes out of her mouth. As a social person, her main goal is to be able to introduce herself. Apraxia of speech is a neurological deficit in the production of speech sounds. It is not caused by muscle weakness. Rather, errors are caused by a deficit in the ability to sequence movements needed to produce sound. Apraxia of speech occurs most commonly when there is an injury to the perisylvian area of the left hemisphere of the brain. However, injuries to the insula and the basal ganglia can also lead to apraxia of speech. Mrs. Johnson's stroke caused damage in the parietal lobe of the perisylvian area of the left hemisphere. The severity of the disorder can range from mild to severe. Mrs. Johnson has severe apraxia of speech. The motor speech difficulties Mrs. Johnson is dealing with are the following: prosody, respiration, phonation, and articulation. Mrs. Johnson is currently targeting articulation in therapy. Her articulation errors arise from difficulty with smoothly sequencing the oral movements needed for speech. One of the most difficult phonemes for Mrs. Johnson is the TH, or in the final position of words. She has inconsistent substitutions, omissions, and distortions. This shows that she lacks a consistent motor plan for the production of TH. In other words, when TH occurs in a word, she is not able to sequence the movements needed to produce that sound. This leads to varied phoneme errors in the place of TH, depending on the coarticulatory context. The location of today's therapy session will be taking place at the Outpatient Rehabilitation Facility in Ann Arbor, Michigan. The 8-step continuum therapy for treating apraxia of speech by Rosenbeck is the therapy technique selected for Mrs. Johnson. Elise will be playing Faith Johnson and Aaron will be playing the SLP. Each of the 8 steps will be demonstrated in the video to address Mrs. Johnson's therapy goal. Her goal for today's session is to improve intelligibility. Mrs. Johnson will produce the TH or phoneme in the final position of words with 80% accuracy and minimal to moderate cueing.
Hi, Mrs. Johnson. How are you doing today?
Hi, I'm good.
Good. Today we're going to be working on that tough sound, or TH. In order to do that, we're going to practice saying your name. Sound good? Okay. So, first, I'm going to say a word, and I want you to watch and listen to me. Faith. Now we're going to say it together. You ready?
Phase.
I heard you say phase instead of faith. So we're going to work on that sound. I want you to put your tongue between your teeth and blow air out. Very good. That's what we're looking for. So now we're going to try this again. The first step where I'm going to say a word and you watch and listen, and then we'll say it together. Ready? Faith. So let's say it together. Faith. Very good. This is step 2. So I'm going to say a word. I want you to watch me again and listen. and then we're going to say the word together with my voice off. So watch and listen. Faith. So now we're going to say it together with my voice off. You ready?
Faith.
Very good. I like how you self-corrected there. This is step 3. So for this step, I'm going to have you repeat after me. Faith.
Faith.
Excellent. This is step 4. All right, Mrs. Johnson, you're doing a really great job saying your sound. So for this step, I'm going to say a word, and I want you to repeat me 3 times. Faith.
Faith. Faith. Faith.
I could hear a TH really clear. Good job. This is step 5. So for this step, I'm going to have you read a word and say it out loud.
Faith.
Awesome job. I like how you didn't have any pauses. That was very smooth. This is step 6. So now I'm going to show you the word and then hide it. And then I'm going to have you tell me what the word was. So be sure to pay attention.
Faith.
I can tell you're working really hard. Great. Sound. This is step 7. So I'm going to ask you a question. I want you to answer. What is your name?
Faith.
Awesome. I can tell you're ready to move on to the last step. This is step 8 and the final step. So it's important that you're able to use these words in conversation. So we're going to do a role-playing activity. My name is Erin. What's your name?
My name is Faith.
Wonderful. That was This is really exciting. At the beginning of therapy, you had a lot of trouble with that sound and the word level. But now you can say it at the conversation level. So this therapy technique has proved to be very effective for you.